Hey everyone, I'm Hannah DePaul. I'm a physical therapist at Adams Sports Medicine and Physical Therapy. We thought during this kind of crazy time here, with a lot of people just kind of chilling at home, that we would help you guys either with your training or just some like pertinent PT topics, things like that. So we have a triathlete who has a question for us that we get a lot in the clinic, and this is Brittany here.
Hi Hannah, so I'm training for my third triathlon now, about halfway through my training program, and I'm wondering if I'm having a little bit of pain. Should I totally stop my training and just wait for it to get better, or can I train through it? Like, how do I know when I should stop and when I can push through?
Yeah, so this is a question that we get a lot with the endurance athletes we work with. When is it okay to push through pain during your training? And I think a lot of that comes back to the type of injury that we're seeing you for. Some injuries, I'm gonna advise complete rest. So like bone stress injuries, stress reactions, stress fractures, or if you have a really irritable tendinopathy, like your Achilles is just really flared up and you're even having pain walking. In those cases, I'm probably going to advise complete rest, where you need to stop biking, stop running, if that's bothering you. For other injuries, I will allow you to continue running and biking to some extent if you can keep your symptoms down and keep overall progressing and getting better. So some of those injuries include like more mild muscle strains, or if it's a hamstring tendinopathy that is a little more stable, it's not getting as flared up when you run or bike. Those would be times that you could possibly train through a little bit of pain. Typically, the advice I say is that if you're looking at the pain scale, 0 being no pain, 10 being the worst pain imaginable, you want to try to keep your level of symptoms at a 3 out of 10 or less. 3 out of 10 meaning it's dull, it's achy, you can feel it, but it's not sharp, it's not causing you to change your running mechanics. Those are the big things that you want to look out for. So if it's staying at 3 out of 10 or less, it's not getting worse throughout your run, and then you monitor it for the next 24 to 48 hours. And if it has gotten no worse in that time frame, then likely that run was okay. It wasn't super provoking that aggravated your injury. If you go for a run and then the next day you wake up and you're like hobbling around because you're in a lot more pain, then that run likely overdid it and aggravated it. So you need to possibly rest for a little bit, and then when you go and try another run, you need to do less. So the goal is to find that baseline level of running or biking or swimming that you can tolerate without making your symptoms worse. And then obviously the goal with PT is I want to improve your tolerance to the swimming and the biking and the running through a strength program or appropriate stretches or things like that. Obviously at this time with the coronavirus, we aren't seeing the patients, but I think that can be some clear direction, because hopefully you guys are still able to run outside or treadmill at your home and bike. And that can be some good guidance if you guys are feeling any pains or niggles. And then hopefully when all this calms down, if you guys need any help, give us a call.